So welcome back, everybody. So if you recall, a few episodes ago, we had talked about ways to reduce risks of complications. And what I wanted us to do at this point is to really start looking at those a little more in-depth, different things that could be complications and how you can help reduce those risks and stay nice and healthy. So today, I thought we could talk about feet. And everybody's like, what? My feet. Okay, yeah. So probably over the years, someone has told you that you have to check your feet every day, or your healthcare provider has asked you, do you check your feet every day? Well, there's a few reasons that you want to do that. But first of all, let's talk about how keeping your glucose in your target range is going to help reduce the two biggest complications that are going to affect your feet. And that's damage to your nerves or damage to the blood vessels that send blood to your feet. So type 2 diabetes, when your blood sugars are really elevated and outside of your target range, that can cause nerve damage or damage to those blood vessels. So then you could lead to either neuropathy, you might have heard of that, so that's nerve damage, and typically it starts to affect feet first. But you could also end up with some, vascular disease that's going to cause difficulties in blood flow and can cause changes to your skin. So the thing about neuropathy is it can be really painful. It can sting, it can burn, it can cause a lot of numbness. But one of the other things it can do too is it can cause a loss of sensation. So that means you might step on a nail and not be able to feel it. Or you could be, maybe you go out hiking in the wintertime. You could be getting frostbite and not feel that. And that, that can be dangerous. So that's why keeping blood sugars in your target range is going to help reduce that risk of neuropathy. Again, with the vascular side of things, or your blood flow. So that can also lead to some of that neuropathy. But then again, it also means that suppose you got a cut on your foot. That reduced blood flow is just going to make it harder for that cut to heal, and cuts that don't heal right away have more potential to become infected, which just then leads to even more difficulties. So that's why you really want to work to get your blood sugars at your target range and keep them there as best you can most of the time, because that's going to help reduce all of those. So now you know why you want to do that, but what can you do on an everyday basis to help take care of your feet? Couple of things. First, you want to keep them clean and dry. And I know everybody, you take a shower, but when you get out of the shower, you want to dry gently in between your toes. Don't be scrubbing in there like this, because when that skin is soft from the shower, it's real easy to tear it or, kind of scruff it up and it gets a little abraded. And that's now open skin. So that puts you at, again, chance for an infection. So you want to dry gently in between your toes. You want to look in between your toes every day. Make sure that there's no cracks in the skin. You want to put lotion on, but don't go crazy. Again, you want to keep the skin soft, but not too moist. One of the other things is that people with type 2 diabetes are really recommended not to walk around barefoot. So again, this goes back to, maybe stepping on things. Maybe you do have a little bit of neuropathy already, but you don't want to, you don't want dirt and all that kind of stuff getting into your feet. So even if it's, you got some nice slip-on shoes that are comfortable for walking around the house or out in the yard, make sure you've got some good sturdy foot cover for when you're, up and about. The other thing is, so toenails. You want to keep your toenails trimmed, and you want to try to keep them nice and trimmed straight across, not where you're going to maybe get an ingrown toenail. And sometimes it can be difficult to cut your own toenails rather, or you might have some thicker toenails that are a little harder to cut. You definitely want to see a podiatrist at this point, because they're really well versed in taking care of feet for people that have diabetes. and not try to, maybe just sort of grind away at it by yourself. And that's another thing. If you have calluses or really thick skin on your feet, don't use those little grinder things on there, people, because again, you're going to open up that skin, potential cause for infection. You really want to see a podiatrist for that. And I know you're saying, well, that's just another doctor. Well, if you have type 2 diabetes, that is a specialist that's covered by your insurance no matter what. And if you're having foot issues, you really want to see them. So other than that, let's see. What do we got? So, all right, pretty much that was it. Making sure your feet are covered when you're walking around. Take good care of them on an everyday basis. See a podiatrist if you need to. If you start to feel like maybe you're having some issues with that neuropathy, if you start to get some of that numbness or tingling or burning, you really want to see your healthcare provider, because if it's already started and maybe your glucose levels aren't where you want them to be, working with your healthcare provider to get them there into your target range can help stop that progression. So the sooner you work on that, the better. And next time, we're maybe going to talk about how sleep affects your diabetes and your glucose management as well. So I'll see you then. Bye.